Welcome to Community Health Heroes, where we spotlight local leaders and organizations that provide much-needed health and wellness resources and information. Our hope is for everyone in our community to strive to live healthier, happier, and longer lives. I'm your host, Leslie Snedowski. Thank you for joining us. Today on Community Health Heroes, we're celebrating Mardi Gras. And while Louisiana ranks #1 for fun this time of year, how does our state rank regarding our health? Dr. Mark Peters, the new Chief Medical Officer for UnitedHealthcare Gulf States, joins us with the latest results from United Health Foundation's America's Health Rankings. And whether you're in a parade or just watching one, attending one of the season's society balls or a neighborhood block party, you need to make sure your heart can keep up with all the carnival craziness. West Jefferson Medical Center's cardiologist, Dr. Carlos Rodriguez-Fierro, and American Heart Association of Greater New Orleans Vice President Brittany will both stop by to talk about the American Heart Association's Go Red for Women campaign. And if you spend the balance of your Mardi Gras running after your kids in the neutral ground as they try to catch beads, cups, and doubloons, you'll find our Community Health Heroes report to be quite an epiphany. Children's Hospital's pediatrician, Dr. Paul Remedios, and New Orleans Moms Blog's Linzy Cotaya will share some great ideas and valuable tips about Mardi Gras safety. And don't be tempted to eat every moon pie you get handed off a parade float. In today's Eat Fit Nola cooking segment, we'll be in the kitchen with Sous Chef Jesse Kennon of Blue Line Sandwich Company. It's a farm-to-table, salad-to-sandwich restaurant, and he'll be here with some healthy alternatives for you and your crew to feast on this pre-Lenten season. So don't go away. We'll be right back with more Community Health Heroes.
This is what high blood pressure looks like. Talk with your doctor to create a treatment plan that works for you. Go to loweryourhbp.org.
Welcome back to Community Health Heroes. Did you know, according to the United Health Foundation's America's Health Rankings, Louisiana ranks 49th in the country for getting a bad health checkup. Our friends to the west in Hawaii ranked #1. With us now is Dr. Mark Peters, the new Chief Medical Officer for UnitedHealthcare Gulf States. And he has the latest findings from this annual report and will share what we can do to improve the state of our health. Thank you for joining us.
Glad to be here.
Now, I know it's Mardi Gras, so I'm hoping there may be some good news in this report, even though Louisiana does rank 49th.
Yeah, there are some good things, some positive things. Some of our residents have lost weight. Obesity has a lot of complications that come from us. Weight loss has been present in some of our residents, and that's a good thing as we move forward. One of the great things that will help prevent illness and disease processes.
When looking at the report, I believe Louisiana lost weight collectively about 1.9%, so that's great news. So something.
It's a great start. It's going in the right direction, and I think that there's more education about do's and don'ts of eating, and also the benefit of exercise. As simple as walking can make a huge difference in metabolism and ultimately in how many pounds each of us weigh.
And I think, Louisiana should get a gold star for that because it's tough to lose weight in this town, as you know, especially this time of year.
It is really, really hard. The food is very tempting. And I think that eating and getting together is part of the culture here, and that's a very positive thing. I think, though, people can make some modifications without losing all the fun that goes along with the Louisiana culture.
I totally agree. And there was another bit of good news, like more people are getting health insurance. Is that correct?
Very much so. And I think that part has been related somewhat to the Affordable Care Act and also more recognition of the value and the importance of health insurance.
I think the percentage was from around 13 to 11% are uninsured, so that's definitely going in the right direction. But there are a lot of areas, unfortunately, where this health ranking report shows that Louisiana is not doing that great. Let's talk about smoking. Actually, it's so interesting because there's so much awareness about the perils of smoking, yet it looks like there are more smokers now in Louisiana.
Very discouraging. It really is, in the sense that I would agree with you. A lot of information out there. I don't think that anyone can say they haven't heard about the negative impacts of smoking. So I think that we have to relook at how we're educating people, because moving in the wrong direction will have an negative impact on all the other health details and diseases that we're looking at.
And there was a big swing, a big percentage point, about 23% more smokers. And I'll tell you, there was another really startling statistic in this report. It looks like deaths from drug overdoses shot up over 17%. Do you think that has something to do with the opioid crisis in the country?
Absolutely. I think that it is directly related to that. It's the opiates and also other drugs that are mixed with opiates that have led to overdoses and unanticipated deaths. It's a critical problem. I know here at United we have a lot of pilot projects going on to try to make a difference. There's no easy solutions. It's a terrible situation, but something that we need to get control of.
And there was one more area that I saw, and it was a little increase, but still there, about cardiovascular disease. That seems to be getting a little more out of control as well in Louisiana. That
is accurate too, and also disappointing. Going back to smoking, smoking contributes to heart disease, coronary artery disease. Obesity, being overweight, doesn't directly relate to that, but it contributes to high blood pressure that then can affect heart disease. So we still have a lot of work to do, but I think education and involvement and cooperation between healthcare providers and the payers of healthcare can make a big difference of working with all of our patients.
And while I have you sitting on our couch, I do have to ask you about the flu season. What's going on? It's totally out of hand this year. What are the doctors saying? Why has it gotten so bad this season?
That's certainly true. I think that every year when the ingredients that go into the flu vaccine are determined, I think they use the best knowledge and information that they can have from the previous year and what's happened elsewhere around the world. Sometimes they don't get it exactly right. Sometimes there's some variation in the flu, and I think that is happening this year. None of that should make any of us think about not getting a flu shot. And flu shots we can get any time during the year. So it's not too late. You can make a significant difference with that. Unfortunately, with bad flu, people can die, and it especially has a terrible impact on those with multiple diseases and certainly the elderly.
And it's also good advice too, especially during Mardi Gras season where you're around people all the time and who knows who has what. So getting a flu shot, now it's nice to know it's not too late to do it. Doctor, if we want to learn a little more about these annual health rankings, where can people go and find them?
The simplest and easiest place is to go to uhc.com. That stands for UnitedHealthcare. A lot of information's there for patients to read about and become more educated.
Well, thank you so much for spending some time with us, telling us about the health rankings and giving us some hints about how to prevent getting the flu, and happy Mardi Gras to you.
Same to you. Glad to be here.
Thank you.
Thanks.
When we return, how the American Heart Association's Go Red for Women campaign is helping local ladies learn more about preventing heart disease and stroke. We'll be right back.
It takes less than 1 minute to find out if you may have prediabetes, and you can do it here. So what are you waiting for? Just go to the site.
Welcome back to Community Health Heroes. Did you know that Mardi Gras is the perfect time to get active and start moving? According to the American Heart Association, walking is one of the most effective forms of exercise to achieve heart health, and walking for 30 minutes a day can provide many heart health benefits. Cardiologist Dr. Carlos Rodriguez-Fierro with the West Jefferson Medical Center and Brittany Gay, Vice President of the American Heart Association of Greater New Orleans, joins us today to talk about the American Heart Association's Go Red for Women campaign. And while we'll see many people walking around town wearing purple, green and gold, and red this month. Thank you both for joining us. I'm so excited to hear all about Go Red for Women Day. I see you dressed the part. Can you tell us all about it?
Yes. Well, February is National American Heart Month. So throughout the whole month of February, we're really doing anything and everything that we can to raise awareness that heart disease is the #1 killer of all Americans, but specifically of women.
So how can women participate? There's some events this month, right? Next month.
Yes, so on March the 2nd, we're having our Go Red for Women luncheon at the Hyatt, and we're super excited. It's going to be a fun day. There's going to be health information and a fun and festive luncheon that features a fashion show. So we're super excited about that. But the whole month of February, we're going to be having a lot of health-related events throughout the month to raise awareness and really empower women with the information and the knowledge that they need to take action in the case of an emergency.
And doctor, I want to talk to you about these emergencies because there are some symptoms you can look out for heart attack and stroke, and they're also different than what men experience, right?
Yes, Leslie, that's absolutely right. It's important because women tend to have a little bit different symptoms than men. In a study that was done at the New England Journal of Medicine a few years ago, they found that the most common symptoms that women had prior to a heart attack was just fatigue. And it's important to recognize because it has not been taken seriously before. And this is one of the reasons why Go Red for Women started in 2004, is to make sure that they're aware. Why? Because, as Brittany said, it's the #1 killer for women.
And I know there's some risk factors you can tell us about, and can you also tell us how we can start reversing some of the problems we may be diagnosed with?
See, that's the most important thing about doing this. 80% of the cardiovascular event that occur in women can be prevented. And the way you do that is by knowing your risk factors. There are two types, the modifiable risk factors and the non-modifiable risk factors. Well, what are the non-modifiable risk factors? One, age and family history and race. The modifiable risk factors are extremely important because those are the ones that you can actually modify, control, and reduce your chances of getting a cardiovascular event. Like what? High blood pressure, cholesterol, diabetes, overweight. All those risk factors are extremely important to know and to modify because when you do that, as I said before, reduction of 80% of cardiovascular events.
Wow, and I guess because of what the doctor said with all those facts, it's one of the reasons why you guys decided to dedicate a whole campaign just for women. I know this is an important campaign for you as well personally.
Absolutely. I think that's what is so striking about this campaign is that the #1 cause of death for women in America is 80% preventable. And I think that statistic alone is very motivational for me personally and for everyone that works for the American Heart Association to really get that message out there. We have an army of staff and volunteers that have dedicated their lives to really empowering women. It's education and empowerment and making sure that not only do they understand what the risk factors are, but then they take action after they understand it. So super duper important.
I know when women think about their health, and I don't think I'm stereotyping here, but you think about weight, you think about cancer. I guess, you don't really think that much about heart disease, and that's why this campaign is so effective, right?
Studies have shown that women are more concerned with weight than cancer or heart disease. And we know that heart disease is the #1 killer in women. Actually, it kills more women than all the cancers combined. And we know that once women get a heart attack, their chances of dying within the first year is 25%. Wow. Compared to men, their risk is 20%. So this is an important fact to know because it's preventable.
And doctor, if people want to do some research, go online, where can they go to find some more information about this?
American Heart Association website, the Go Red for Women website, but basically they need to get information from their physician. Very important. And talk to them. They're your partners. They're going to work with you to make sure that you're as healthy as possible. Not only that, but you probably have a mother, sister, daughters. Take care of the whole family and friends.
And Brittany, what is that website for Go Red for Women again?
So for information on the Go Red for Women luncheon and campaign, it's neworleansgored.heart.org. And for general heart health information, it's just www.heart.org.
Right. Well, thank you so much, both of you, to come and tell us this valuable information. I wish you a lot of luck in the campaign and happy Mardi Gras.
Thank you.
Happy Mardi Gras to you.
When we return, a local children's hospital pediatrician and a mommy blogger share some tips to keep your kids safe this carnival season in our Community Health Heroes report.
Where are you headed?
Just gonna hang out.
If any of your buddies ever pressure you to take a drink, just tell them you promised your dad you wouldn't.
I promise. Love you too, Dad.
They really do hear you. For tips on what to say, visit underagedrinking.samhsa.gov.
Did you know tens of millions of pounds of Mardi Gras beads are shipped to New Orleans every year to be thrown off of parade floats during Carnival? And more than 1 million people come to New Orleans to celebrate? That means there's a high percentage your child will get hit and hurt by flying beads during a Mardi Gras parade or lost among a crowd of strangers. But one children's hospital pediatrician and one local mommy blogger say planning ahead is the best way to let the good times roll. Mardi Gras. It's a kids' carnival full of flashing lights, colorful throws, and festive sounds. For Annalise Cotaya, Mardi Gras means she gets to dress up like royalty. Her family has been a part of the crew of Carrollton for generations.
I think New Orleans is the coolest city ever. Where else can little girls be princesses and queens and ladies in waiting, yearly? They get these fancy dresses and they go to Mardi Gras balls and they learn how to curtsy and sit correctly. The formality of Mardi Gras is just awesome.
Annalise's mom, Linzy Cotaya, is a contributing writer and executive team member of the New Orleans Moms blog and helps other moms troubleshoot the perils of the season on and off Mardi Gras floats.
I think a lot of the concerns we get are more how to be prepared out there with your kid, packing snacks, where to potty, how to keep them entertained. It's a long day. Once you head out to the parade route, you're really committed to being out there. And so how do you make the day go as seamless as possible is really what moms are looking for.
The big thing when you bring your children out, whether they're 2 months or 2 years, is always having an escape route. So, you have to always expect that, if your kids get overwhelmed, get tired, cranky, fussy, or just are kind of over it, that you can easily get out, get home, or get to somewhere where you can rest.
At Children's Hospital's Napoleon Pediatrics Uptown, Dr. Paul Remedios tells parents to bring food and drinks, hand sanitizer and toilet paper, Band-Aids and sunscreen, and hats and sunglasses when they take their kids out to a parade.
Infants like under a year old probably should have some kind of ear protection because, the bands and those kind of things get very loud, so you want to protect their ears. A lot of kids should be wearing eye protection, especially the ones that can't really put their hands in front of the faces, know how to catch.
I think it's really an opportunity during Mardi Gras to think through the situation. There's probably going to be, different plans that you needed from last year. If your child started walking or if they're crawling or even if they're an infant, the plans need to change every year. What worked the year before is not going to work this year. And so for our family, we like to talk about it. My kids are 3 and 7, so they understand a little bit about stranger danger and about being safe. And so for us, we talk about what's the plan.
The Jefferson Parish Sheriff's Office has a plan, and it includes marking children's clothes on the inside with their name, address, and phone number, to go to the same familiar areas to view parades, show kids a landmark to meet at if separated, and show them how to recognize a uniformed police officer if they need help. Parents also need to make sure the beads their kids catch stay in their hands or around their necks and not in their mouths.
First and foremost, they're always a choking hazard, but you don't know where these beads have been before, whether they have lead in them or not, and so they always present a way to get a way for infection to spread. So especially with this flu season going around, it'll be important to make sure your kids know not to put beads in their mouth. But if they're the type of children that kind of do that anyway, you want to make sure that they don't have them easily available. So if that means taking them away or putting them to the side, or just having to be very vigilant about whether it's beads or other kind of throws being put in their mouth, you have to kind of keep on top of them.
I kind of feel like everything at Mardi Gras is dirty, so there's always so much you can do. But I feel that if my child comes home with a stuffed animal she becomes attached to, we definitely spray that with Lysol before it heads into her bed for the night. But we're also an allergy family, so anything that comes off of the float that's edible, we'll definitely do due diligence for and see if she can or cannot eat that.
Both mommy blogger Cotaya and Dr. Remedios say ladders along the route are a great way for kids to experience Carnival and a way for parents to keep them safe.
I think they can serve a purpose if it keeps your kids elevated. It also keeps them in one spot. So if you can make it fun and have somebody stand up there, behind them, that, is always helpful.
So ladders, I feel, are just a part of Mardi Gras. They're a necessity, especially with small kids. I've tried to do Mardi Gras without ladders. It ends up being a lot more work. The holding the kid up, making sure they can see the float. It's a lot of energy that you're expelling while you're trying to keep them contained. So if they're in the ladder, they're happy, they can see, you know where they are. They're a pain in the butt to haul out there, but once you get them out there, I just think it's something you need to have. Being in Mardi Gras and getting in there and dancing in the streets and really enjoying it is what I hope that kids of New Orleans get to experience.
I'm Molly Kimball, registered dietitian and founder of Oxner's Eat Fit Nola. We've collaborated with more than 100 partners locally to create Eat Fit Nola, a partnership that highlights the better for you items right there on our restaurant's menu or on grocery store shelves, making it effortless for you to dine at your favorite restaurant or shop your favorite market without ditching your otherwise healthy diet. Every month, Community Health Heroes Show, which is sponsored by the United Health Foundation, will shine a spotlight on an incredible chef to help show you how you can make smarter food choices to live a healthier, happier, and hopefully longer life. In addition to Eat Fit Nola, you can find our partners such as Eat Fit North Shore, Eat Fit BR, Eat Fit Bayou, and coming soon, Eat Fit Acadiana in a neighborhood near you. So don't go away, Community Health Heroes will be right back.
If your Mardi Gras diet consists of fried foods and king cake, I'm here to tell you you have tasty, healthier options available, and some can be found at Farm to Table restaurant Blue Line Sandwich Company. Here with us today is sous chef Jesse Kennon with Blue Line Sandwich Co. He's here to prepare a superfood wrap. And also with us is Eat Fit Nola Ambassador Emily Eickoff, who I hope will tell us it's okay to eat some junk food during Mardi Gras. You can't take my king cake away from me. Well, happy Mardi Gras to both of you.
Happy Mardi Gras. Thank you for having us.
Before we start, I just want to talk about this farm to table concept.
Absolutely.
Tell me what it is exactly and why is this so successful at Blue Line?
So our farm to table menu is centered around local farmers and local produce, and being that we're in the South, there's an abundance of it pretty much year round, whether it's citrus, tomatoes, potatoes, even local seafood. There's always something that we can work with and make a dish with that people have seen, and there's also a lot of things that people haven't seen. So the whole point of our superfood salad, our superfood wrap, and a couple of our new menu items is to bring things that people haven't really seen in this area or didn't know were popular or growing in this area to their table.
So the super thing about this is that it shows off local ingredients, but I know there is a term called superfoods out there, which means they're extra nutritious. So do you want to step in, Emily, and tell us why this superfood wrap is going to be so great?
Yes, the superfood wrap is wonderful. It's a superfood is filled with phytochemicals, which are found in your leafy green vegetables, your almonds, quinoa, and your whole wheat pita bread. So those are things that are going to be higher in protein, higher in good carbs and fiber, and also high in monounsaturated fats, which prevent against heart disease and other types of cancer. So they're really great for you.
Well, so Chef Jesse, this doesn't look too complicated. Can you kind of show us what's going on? How do you make this?
Not at all. So we recently added the superfood salad to our menu, and that's what I have going on here. It has, like Emily was saying, the leafy greens. It has baby spinach, kale that's grown locally here. We've got cherry tomatoes from Covey Rise Farms.
They're delicious.
Oh, they are. And they've been a season longer than normal this year just because of the weather change. So we've been able to get them a little bit longer than normal, and then they're starting to come back in season. So we'll be getting those heirloom tomatoes in larger varieties soon. Other things like carrots, the Bravo radishes, which I'm a big fan of, just the way they look on the plate.
And they're cut very finely, I see. Someone chopped them really finely.
Right, we slice them on a mandolin and chill them in ice water so they kind of curl up, and it's got a nice mouthfeel. It offsets the beans and the quinoa and the avocado that goes on top of the salad as well.
So you basically take all those ingredients and you mix them first, is that it?
Right, so what we'll do is we'll take all the greens, most of the quinoa, and a lot of the edamame, salt, pepper, and our dressing. And for the superfood salad, we're using a citrus and herb dressing. So it's got garlic, salt, pepper, not a whole lot of salt, but salt, pepper, apple cider vinegar. So it's got kind of like a sweet, tangy, good offset in flavor for things like avocado and the almonds that are in the salad.
So basically this is the salad portion, and you just wrap this up and just...
Yes, ma'am. So what I'm doing now is I'm taking all the ingredients from the salad, and we're just going to throw it right into the wrap. So I'll take the avocado and almost do like you're going to make guacamole and spread it along the inside. And then let me grab a napkin.
This looks so pretty. It smells great. It smells fresh from, it's kind of, it sounds cliche, but it smells fresh from the farm, doesn't it?
The broccoli and the tomatoes came in this morning.
Wow.
The kale came in yesterday.
So you recommend putting the dressing in first so you can wrap it in, so you don't
Right.
You just put it in right?
As far as the wraps, once it's wrapped up in the tortilla, it's going to stay good. If you're doing the salad on the side or something like that, then we recommend putting the dressing once you get there, or just wait until you're ready to eat it and doing it in a little small side bowl.
I gotcha. So all that goes in there, and then you have fun rolling it, huh?
Right. So the hardest part about an all veggie wrap, a lot of people won't tell you, is like when you have a breakfast burrito or a tortilla or something, you always got cheese or egg or something, salsa to keep it together. Well, with vegetables, it's a little bit more difficult.
Yeah, to find a binding agent, right?
Right. And salad dressing isn't always the easiest or best binding agent.
And Jesse, in your experience as a chef, have you found that this whole farm-to-table concept really exploding? Is there a big demand for it?
Oh, 100%. I think with the opening of our second location 2 months ago, we added the superfood salad and a couple other Eat Fit menu items, and they've really kind of taken off.
And you mentioned 2 locations. There's one in Old Metairie.
Old Metairie, we're on Metairie Road, right by Metairie Road in Bonneville.
And the new one is CBD, right?
CBD, so we're on Poydras and South Rampart, right across the street from the Energy Center, right around the corner from the Dome.
And as you start cutting this, you're going to tell us where the Blue Line name comes from?
Right, so the Blue Line name, when I started with Chef Brad, there was no history behind it, no one knew, and then all of a sudden one day, a big poster showed up, and it was a giant streetcar and a big explanation of what Blue Line was and why we named it that. And essentially, it was one of the only streetcar lines that ran from the city out to Metairie.
That makes sense.
100 years
Blue
ago.
Line.
So.
That's cool.
We need one of those again, I think.
Right.
And I believe Chef Brad's wife, Stephanie, is from the Old Metairie area.
Yes, she is.
She definitely would appreciate that history. Well, these look fantastic and super easy to make.
Right. So you can see it is a little difficult sometimes to get them to all stay in there, but we'll pick it with a...
These are really pretty, how you wrap them like that and stick them through the tomato.
Right,
It's really pretty.
Just like that. So for the sake of your parade route, you're probably not going to put the tomato in there.
That's the best part.
On top.
That's beautiful.
Really easy to...
Right, super easy, quick. I mean, and then this mix right here, even with the dressing on it, you can put it in the refrigerator, pull it out. Kale's super, fibery. It's not going to wilt that easily. Not like things like romaine or, a little bit softer green, but...
Well, this looks fantastic. If people want to go online to take a look at the menu, where do they go?
BlueLineSandwichCo.com.
That sounds easy.
We just updated our catering menu, and we fixed our website so it's easy to navigate between the 2 restaurants, whether you're ordering or picking up or trying to do a catering order or anything like that.
And Emily, tell us a little about Eat Fit. Where can people learn some more information? And I hear you have a new app out right now?
Yes, we're so excited to tell everyone that we have a new app that you can download in the App Store. And it's similar to our old one, but a little bit easier format for people to get around and find recipes and pictures of their favorite dishes. You can also recommend a restaurant that you'd like to see become an Eat Fit restaurant. So really great resources there.
Well, thank you so much. This was a lovely presentation. I really appreciate it. I'm sure everyone in the studio is going to be coming close.
Right, we brought plenty. So.
And happy Mardi Gras to both of you.
Happy Mardi Gras. Thank you so much.
And your recipe will be on our Facebook page and our website at communityhealthheroes.org. We'll be right back.
Hart, what's going on? I'm leaving. Why? What did I do? Not enough. The pressure's too much. I quit. I get it. I can do better. Just please don't leave.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Thank you for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit Nola restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com. If you'd like to learn more about our guests and share segments from our show, check out our website at communityhealthheroes.org. And you can also find our show on YouTube. We hope the information we've provided you on the United Health Foundation's Louisiana's Health Rankings, the American Heart Association's Go Red for Women campaign, Mardi Gras safety tips for your kids, and healthy eating alternatives for Carnival will help you and your family live healthier, happier, and longer lives. I'm Leslie Snedowski. Happy Mardi Gras, and make sure to join us next time for more Community Health Heroes.
Okay.